Oh, hello everyone. My name is Nariaki Miyata. Today I'll give a talk about combination treatment with HIFE and RF. Okay, at first, I introduce myself. I'm board certified plastic surgeon. I own my clinic in Shimbashi, Tokyo. Of course, I perform surgical procedures. However, my main practice is treatment by using various energy-based devices. Okay, in my clinic, I have Ultracell Q Plus, Action, and other devices. The over 40 devices. It's like chaos. So many doctors say I'm crazy. As introductions, I'll talk in general. Recently, there are many devices to treat sagging, tightening the tissue. Commercially available. Main source is radiofrequency and high-intensity focused ultrasound, like Buceral and Samaj. About face lifting treatment. What is the trend of the world? Patients don't prefer to be performed surgical procedures, and device treatment has been the main law. Also, the effect is inferior than surgical procedures. The advantage is less downtime and painless. In aesthetic medical field, it's no longer possible without device treatment. The key words are no incisions, no swelling, not painful. And there are various non-surgical treatment methods for sagging. About injection, collagen, hyaluronic acid, platelet-rich cell plasma, hydroxy apatites, botulinum toxins. It means fear and neuromodulators. And but devices, laser, IPL, radio frequency, threads, short thread. In our clinic, I use this kind of device in my daily practice. The RF, the Samad FX, accent, action, but ultrasound, it means high intensity focused ultrasound, the Ulcera, Ultracell Q Plus, and some Korean company product. The laser light, the Gentle Max Pro, Icon, InMax, the plasma, the Plexar, and the Legat. And I talk about characteristics in Japan. Samaj and Ulcera are the two major devices. However, patients prefer to be performed by moderate treatment devices, but they are less effective. Huge number of these treatments is performed. How about your country? Then I'll talk about treatment layer of sagging. For sagging, it's not effective if we treat only surface of the skin. To get tightening effect, a three-dimensional tightening of the skin and subcutaneous tissue is required. It's a result of Samaj. Before and after 2 months, you can see tightening effect of her lower face and face line. About subcutaneous to smooth. Most effective procedure for lifting is surgical procedure. The facelift operations, which lift up not only skin, but also smooth and even retaining ligament. Non-surgical device, HIFE can give some damage to smooth without downtime. The first one is Ulcera system. So what is HIFE? High intensity focused ultrasound. Ultrasound is focused in the tiny region, and only the focal region is heated to 80 to 100 degrees and coagulate tissue. And different focus depths, it means different targets, such as dermis, subcutaneous tissue, and mass. Each of these layers is denatured and contracted by heat. It's a result of Ulcera. So before treatment and 3 months after treatment, you can see lift up and swimming effect of lower face. The compared effect of SURMAGE and Ulcera. SURMAGE is mainly tightening skin, and Ulcera is mainly lift up. However, neither create dramatic effect. About clinical efficacy, there is difference. SURMAGE has three-dimensional tightening effect. Ulcera has lift-up effect. You can see the blue color is the Ulceras and orange color is the SURMAGE efficacy. Now, how about combination treatment? You can see both tightening and lift-up effect. In the second case, in the combination cases. Sorry, it's the combination cases. And second cases, almost the same effect. You can see both tightening and lift-up effect. The combine Ulcera and SURMAGE. By combining two devices, we can get both tightening and lift-up effect. However, procedure using both is very painful, and consumables are expensive. It means high treatment fee. Therefore, patients can't decide to perform this treatment even though it is effective. The big problem is painful and expensive. So how about other combination? Okay. Is there any idea that cannot be done by SURMAGE and Ulcera? Yes, consider about characteristics of combination treatment by using JACIS RF Accgen and HIFE Ulcera Q+, I believe. Okay, before introducing new idea, I introduce the equipment. The Accgen, the grid RF and needle RF device. Here is specification of Accgens. The 6 MHz RF. The type is monopolar and have two types of handpiece. One is needle handpiece, another is grid RF handpiece. And grid RF have two types of tips, and needle RF have three types of tips. I usually use grid type tips. So what is grid RF mechanism? I'll talk it based on intelligence theory, its origin. It's grid fractional radio frequency. After RF emission on epidermis grid shaped heating. And in dermis, RF heating creates uniform thermal zone. The theoretical basis is RF, density heating. Selective heating dermis through epidermis with high impedance value and large heat produce thermal, can say, forming electromagnetic fields and heating in dermis without direct current carrying of epidermis. This method can heat dermis without increasing the temperature of epidermis. And RF pulse barrier heating. Dipole rotation theory. By using grid electrodes and insulating film, RF electron field is formed in skin tissue without direct current flow. The epidermis is a tissue with small water content, high resistance, and an electrical barrier. Beyond the epidermis, active bipolar movement of the water molecules in the dermis occur, causing the heat of friction between the molecules, like this. Heating depths of grid RF. After RF emissions, temperature of 1 mm depth is plus 15.5 degrees and 2 mm plus 18.9 degrees, 3 mm 8.8 and 4 mm 3.3 degrees. As the characteristic of RF, the most thermal effect is seen subcutaneous 2 mm depth. And immediately effect is collagen contractions. Triple hex structure of collagen contract and increase volume by heat energy generated by RF. This effect usually settles down in about 1 to 2 weeks. And after a few days, there are many biological reactions. TNF alpha, TGF beta, interleukin 1, and Hitchcock proteins. It means promote wound healing process. And secondary effect, the collagen remodeling progresses over time. Fibroblasts produce type 1 collagen. You can see the collagen synthesis after 70 days. And the difference of temperature lies between single pass and merge pass emissions. Pass is 1 and 4 pass. Energy 200 watt. Fluence 236 joule per square centimeter. At the depths of 1 mm and 2 mm, no difference in temperature lies, but obtained between 1 pulse and 4 pulses. At the depths of 3 mm and 4 mm, there were difference. Temperature after 4 pulses lies higher. 4 pulses make thermal storage in the deep layer. So from intelligent to Acgen, what is the difference? Intelligent multipass 4 pulses and Acgens have 20 pulses, 18 to 36 pulses. It's a feature of Acgen. The 20 pulses. 30% less pain, 3 times stronger energy than other devices without skin burn. It has unique terrain pulse, many pulses of RF, and features of terrain pulses. Temperature in dermis rises to 40 to 45 degrees within 2 seconds and lasts more than 8 seconds, a long time. 40 to 45 degrees hits target layers. The features of Acgen's grid RF. The 2 mm depth is most heated by grid RF. With the train process, heating for a long time, and thermal storage zone is wide. It's approximately 4 mm. It's a big difference. Less pulses is heating the 2 mm, but train pulses heating depth is 4 millimeters, but most heating zone is 2 millimeters. And the next device, Hive. Ultracell Q Plus, speedy and compact Hive system. Its specifications. The frequency is 2 MHz, 4 MHz, and 7 MHz. And the depth is 1.5, 3.0, 4.5, and additionally 2.0, 6.0, 9.0 millimeters. The many cartridges. Okay. The future. The food face treatment we use usually is 400 lines. It spans 10 to 12 minutes. The cartridge is very slim. Side viewing angle is 70 degrees. Other companies is 43 degrees. It's big advantage and less pain. Is it advantage? So less pain means less fun. The contains 3 shot with Ultracell Q Plus cartridge. Temperature test by phantom model. It includes thermochromic microcapsule, color change white at 60 degrees or higher. You can see white color change in the left side pictures. Compare with USER and Ultracell. USER has strong focal point, which is a cause of pain. It will not be possible to burn without pain sensation. However, if thermal denaturation occurs 60 degrees, that is enough. Painless and effective is best, of course. There are two types of patients. Patients who require dramatic effect and tolerated severe pain, and other is patients who required moderate effect and less pain. And Action and Ultracell Q Plus conventional therapy. House depth of heat. Ultracell Q Plus. Depth is 1.5 mm, 3 mm, 4.5 mm, and 2 mm. Action has a 20 pulse. Deep heating. 4 mm for long time heating. Thermal storage. The depth matches. It's very interesting. For further pain relief, treatment of Hive is painful. How to reduce pain sensation? Can we relieve pain with heat? It's a bath theory, I call it. In winter, if your body is cold, you cannot take a bath. You feel pain, not heat sensation. However, after warm yourself by hot water shower, you don't feel pain. So subject and method. We verified bath theory. Subject 10 patient. Check bath score for cheek. Method subject gender, age, and pain level of face. Gather information of subject. Pain assessment of face. Right cheek treatment, Hive and RF combined, and left cheek treatment only Hive. The parameter Hive the length 25 mm, spacing 1.5, and power 0.8 joule to both cheeks. RF Action Advanced Mode, it means 18 pulses. Level 3, the only light cheek. The 1 Baker Face score. 0 means no pain. 5 is intolerant. A method that indicated the strength of pain by facial expressions and asking the corresponding facial expression to be digitized. The results, the gender is a male 7 and female 3, and age is from 20 to 80s, 50s. In the score count, almost of them feel less pain on right side. This side combined both RF and HIF. Combination treatment reduce pain. And we tried clinical study. Its protocol. Actual train pulse was set for 4 seconds, 18 pulses from 75 to 123 joules per square centimeter. It means level 2 to 3, treating cheek to neck. Immediately after left cheek treatment of Acgen, treatment by Ultrasec Q Plus with 4.5 mm depth cartridge, 1.5 joule. Then with 3 mm cartridge, 0.8 joule. Immediately after is very, very important. After completed left side, do a same treatment on the right side. It means the only HIF. It means combined HIF and ultraself. Both sides treatment by the combination treatment. So yet clinical cases. In the case 1, before and after. After second treatment, you can see face restart tightening effect. It's an oblique view. And it's gray mode view, it's a 3D view by Quantificare. You can see the difference. And case 2, before and after second treatment. You can see lift up effect on her jaw line changed. And oblique view. And case 3, you can see tightening effect on her cheek. And case 4 is the same before and after first treatment. You can see the slimming and lift up effect. The case 5, before and after first treatment. You can see the difference. It's my final slide. Combination therapy of Acgen and Ultrasec Q+. Not exactly same effect as Samcu and Samaj and Ucera, but it has far less pain. Total treatment time is about 20 minutes. It means comfortable and reasonable, speedy and effective treatment. I think efficacy is not always the answer. There is a very important issue for aesthetic medicine, the less pain. Moderate efficacy with less pain is a key, I think. Today, I talked about combination therapy. Of course, the HIF alone and RF alone is effective, but combination treatment is more effective. But also, it's reduced pain, I believe. So the moderate treatment, combined treatment, is better for Asian, especially Japanese. How about Korean or how about Chinese? I don't know. But this kind of treatment is very helpful for us, I think. Thank you for the attention. Okay, I will answer some questions. Okay, the first one is why do you treat RF first and do HIF? So I already explained about birth theory. The first RF, it means it reduces pain to treating by HIF. So some studies shows both HIF and RF treatment is better than single treatment, and it's some little bit difference. HIF after RF and RF after hive. So I know, but I focused on the pain sensations. So back theory is very useful for us. So the first RF is better, I think, to reduce pain. And the second question, okay, what's the interval between the sessions? I think the interval is 1 month is better. Of course, we can wait for 3 months, but I stimulate the wound healing process. So 1 month is better. If we treat within 2 or 3 weeks, sometimes it's dangerous because the hive can destroy the tissues. So we should wait a month, I think. Third one? No? Okay. Is there any questions? So now is the time to end. Thank you for everyone.